Hello and welcome to Your Government in Action, a presentation of Bahamas Information Services. I'm Carissa Williamson. The government of the Bahamas is prioritizing food security as a part of its ongoing transformation of the Bahamas Department of Correctional Services. The Ministry of Agriculture and Marine Resources donated 100 layered chickens and agriculture tools to the department to enhance its agricultural program. The donation ceremony took place at the Bahamas Department of Correctional Services on March 10, 2025.
For over 30 years, the Ministry of Agriculture and Marine Resources, through its lead technical agency, the Department of Agriculture, has collaborated with sister government agencies and NGOs to promote the importance of self-sufficiency in food production. However, today marks a new era and significant step in our commitment to strengthening food security and sustainability in the Bahamas. Through the Ministry of Agriculture and Marine Resources, we are indeed proud today to donate 100 layered chickens and various agricultural items to the Bahamas Department of Corrections. This initiative aligns with our New Day government's vision of reducing dependency on imported food and ensuring that institutions like BDOCs can become more self-sufficient. The importance of feeding ourselves has been a national conversation for decades, and recent events such as Hurricane Dorian and the global pandemic of 2020-2021 have further exposed our vulnerabilities. These challenges underscored the urgent need for us all to take decisive action in strengthening our local food production. In recent weeks, my ministry has launched several initiatives to expand the agricultural sector with a focus on empowering Bahamians and Bahamian institutions to produce their own food. Today's donation is a part of an even broader strategy. By equipping BDOCs with egg-laying chickens and agricultural resources, we are not only reducing the cost burden on the taxpayers, but are also creating a sustainable food source within the institution. This will help to ease the financial strain that the Commissioner mentioned associated with feeding inmates, while ensuring that they have access to locally produced fresh produce. More importantly, this initiative creates an opportunity for rehabilitation. Believe it or not, agriculture provides meaningful work, practical skills, and a sense of purpose. By engaging in poultry farming and crop production, those serving time at BDOCs can develop valuable skills that will help them reintegrate themselves into society and to pursue productive futures upon their release. Minister Monroe, Commissioner Clare, this donation is more than just a provision of resources. It is a pledge of our continued support from the Ministry of Agriculture and Marine Resources. Along with these tangible items, the Department of Agriculture's dedicated team will indeed stand ready to provide expert guidance and technical assistance to ensure the success of this initiative. I want to thank you for your partnership as we work together to improve food security, ease financial burdens, and create new opportunities for rehabilitation within these walls.
But it's my pleasure to be here this afternoon. And as Minister Campbell says, it isn't only about food security, In 2016, when as a member of the Parole and Reentry Committee, I traveled with members of that committee, including Pastor Dave Burrows and others, to Jamaica to look at how their parole system worked. And what we found is that quite a number of the former residents of their prisons, when they exited the prison, went to work in the agricultural sector. And I remember being up in a high hill and speaking to a gentleman, and he said he chose to do that for a number of reasons. The first was that he got in trouble in city, so he came to country where there was less trouble. And secondly, coming out of the penitentiary, he had a criminal record and people were slow to hire him, and agriculture gave him an opportunity to work for himself. And he showed me mounds of yams. He produced hundreds of pounds of yams, he said. And he had gone from being a small holder to, I think, over 300 or 400 acres of land under cultivation. And that is the vision that we have here. This is a part of the crime effort on the back end called rehabilitation. You see, these men can be in a cell with 5 or 6 other residents all day, or they can be outside learning how to do something productive for when they are released.
The Ministry of Health and Wellness is sounding the alarm over an increase of sexually transmitted infections in the Bahamas. At a press conference held at the Ministry of Health and Wellness on March 12, 2025, officials reported an uptick in cases and urged the public to take the necessary precautions, stressing the importance of testing, education, and prevention measures in order to curb the spread.
We are here to share some important public health information regarding the recent trend in sexually transmitted infections in the country. My ministry's infectious disease unit monitors the trends of sexually transmitted infections and HIV, and recent data has revealed that there is a significant increase in reported chlamydia cases in the month of February. Between January and February of this year, a notable rise in laboratory-confirmed chlamydia cases was observed. In February, there were some 131 reported cases, which is a significant rise in cases compared to the unit's typical monthly total. According to the data, 2 most affected groups are between the ages of 15 to 19 and 20 to 24, which accounts for approximately 27% of reported cases. Ladies and gentlemen, this uptake in cases is cause for concern, and we in the Ministry of Health is alerting the population. When chlamydia is left untreated, it can lead to serious health complications, particularly in women, including infertility and pregnancy-related complications. Additionally, there's an increase in one STD. We can notice the trend of other STDs that will follow, like gonorrhea, syphilis, and HIV. In response to this increase in numbers that we have seen in the country, the Ministry of Health and Wellness is now strengthening our public health efforts by increasing public awareness through education, outreach programs, and expanding access to testing and treatment services. In view of this increased uptake, my ministry encouraged all sexually active individuals to take charge of their own sexual health. 1, get tested regularly for STIs and HIV because knowing your status is key. We're advising individuals to practice safer sex by using protection such as a condom. And lastly, to seek medical care immediately if you experience symptoms. Finally, the Ministry of Health and Wellness remains committed to safeguarding public health, ensuring that accurate information, essential resources, and quality healthcare services are available and accessible to all Bahamians.
STIs like chlamydia, gonorrhea, and syphilis can be mild. There are some cases where people do not have any symptoms any at all. And so that means that people do not know that they are actually infected. But in the case of where there are symptoms, here is what the person could be experiencing. In the case of chlamydia, there's pain during urination. There's abnormal discharge from the vagina or the penis or the rectum, and there can be lower abdominal pain. In the case of gonorrhea, these are the similar symptoms, but they can also cause pain and swelling in the testicles or pelvic pain in women. Syphilis starts as a painless sore. It then progresses, that sore will go away. It then progresses to rashes, lymph node or gland swelling, and at later stages, it can be very serious. It can affect the organs of the body, including the heart and the brain. It is a very serious infection if untreated. Because these infections often go unnoticed, people can spread them unknowingly. So regular screening, especially for those sexually active, is very important. And why is it important to seek care and treatment? If left untreated, STIs can lead to serious complications, including infertility, pelvic inflammatory disease, and in the case of syphilis, damage to the brain, the heart, and the organs. And they can also cause an increase in HIV transmission. That's very important. The breach in the private area and the inflammation in the private area makes it easier to get HIV with unprotected sex. And we do not have a currently widely available cure for HIV. It's a very serious infection. If you are diagnosed with an STI, well, if you have these symptoms, please see your healthcare provider. It will not go away on its own. But if you are diagnosed with an STI, it is critical that your sexual partners are tested and treated to prevent reinfections and further spread. So if you have an STI, you can be treated, but if you have that partner and go back and have unprotected sex, you'll be infected again. Sex partners need to be tested and treated, and this helps to break the chain of transmission. And so your healthcare provider will be asking for you to send your partners in so that they can get screened and tested and treated also. That is a normal part of how we treat these infections and take care to make sure that it doesn't start to spread in large amounts. Prevention is key. STIs are preventable, and here is how. Practice safe sex. Reduce risks for STIs, and some of those ways may include mutual monogamy and limiting the number of sex partners. And in cases where that is not being done, well, practice safe sex and use condoms and testing partners, testing yourself in partners, know your status. Condoms are very, very effective. We are seeing a sexual practice where there's a drop-off in people using condoms. And this is a matter of concern. It will cause an increase in STIs and HIV. And there seems to be a trend, a practice of this going on. So use condoms correctly and consistently throughout the sex act from beginning to end with water-based lubricants. And they're a highly effective way of preventing sexually transmitted infections.
And now we take you up north with Andrew Coakley of our Northern Service.
Free health care. That's something that was once considered a misnomer here in the Bahamas, but under the Davis administration, free health care may soon become a reality.
Our administration will be offering free medications to Bahamian citizens across the country suffering from chronic non-communicable diseases.
Minister for Health and Wellness, in his presentation to Parliament during the mid-year budget debate, outlined exactly how Bahamians across the country will be able to participate in this revolutionary health care system.
Yes, under the complete universal primary health care package, NHI patients will see the doctor free, will get lab and diagnostics free, and very soon medications for chronic non-communicable diseases will be provided free of charge in both the private and public sector
for those clinics who receive or accept NHI. This new policy decision by our administration would not only help the poor, the unemployed, but it will also keep money in the pockets of our constituents. But it would also improve medical compliance and keep patients out of hospital, improve clinical outcomes for thousands of NHI patients across the country.
This innovative healthcare system set to come on stream in the Bahamas is a part of a plan by the government to bring the country closer to universal healthcare coverage. And this is for all Bahamians, including those here in Grand Bahama and the Northern Bahamas. However, before the plan can be fully implemented and instituted, there are a number of steps that must be taken, including passing certain pieces of legislation. Dr. Davil gave an in-depth look at some of the steps that have already been taken thus far.
The good thing about this midterm budget debate is the fact that we'll be right back here in a few months to debate the 2025-2026 budget, where I intend to go into full details of what my ministry is doing to speak about union agreements, medical training and recruitment, hospital and clinic development, while articulating our transformative agenda for healthcare reform across the country. And during my last budget communication, I foreshadowed my ministry's plan to move the chronic drug prescription plan from NIB to the Ministry of Health and Wellness. Well, I'm pleased to report to this honorable House that the management of the NIB chronic drug prescription plan is now nested in the Ministry of Health and Wellness. Much work has already been done with our partners from NIB, NHI, to move this plan to its final destination, which is the National Health Insurance Authority. To facilitate this transition, I plan to lay a compendium of bills, mainly the new NHI Bill 2025, that would repeal and replace the current NHI Act, along with amendments to the Pharmacy Act, the NIB Chronic Drug Prescription Plan Act. And once these bills are debated, passed, and gazetted, my ministry will finalize the necessary legal adjustment, taking us closer to universal health care coverage by way of national health insurance.
The health minister was proud to point out that NHI was conceived and birthed by the PLP government back in 2016. Now, he added, it is this PLP administration who will push forward the second phase of the plan, which is universal catastrophic health insurance.
Because if the truth be told, our administration is heading in the right direction, implementing a more robust universal primary health care coverage. As it stands, the NIB chronic drug prescription plan, now managed by my ministry and currently providing free drugs for chronic non-communicable diseases for just over 44,000 Bahamians, mainly governed by healthcare workers and their families. Once transferred to NHI, the 160,000 plus registered NHI members who suffer from chronic non-communicable diseases like hypertension, diabetes, heart disease, certain types of cancers, renal insufficiency, mental illness, and other illnesses will finally have access to life-changing medications free of charge. This is a huge initiative by our administration and will change medical outcomes.
Dr. Davil also pointed out that the recent announcement by Prime Minister Philip Davis of a 50% VAT reduction on food items, particularly healthy food, will go a long way in helping Bahamians live a more healthy life. For Your Government in Action, I'm Andrew Coakley.
More of Your Government in Action when we return.
Good day, Bahamas. I am Woman Constable 4128 Viola Price, and I am excited to announce that the Royal Bahamas Police Force will be inspiring young minds on National Reading in School Day, taking place on Wednesday, the 19th of March, 2025 at 9 a.m. On this special day, police officers will visit public primary schools across the nation to read to students, share stories, and encourage a love for literacy. Reading is the foundation of learning, and we are committed to empowering the next generation through education and engagement. We look forward to making this a fun, interactive, and memorable experience for young learners. Let's read and make a difference, one book at a time, as we continue to create safer communities.
Welcome back. The Consumer Affairs Unit marked World Consumer Rights Day under the theme A Just Transition to Sustainable Lifestyles with a one-day exhibition aimed at promoting consumer rights and raising public awareness. Held on March 14, 2025 at the Office of Consumer Affairs, the event featured vendors from various industries, including agriculture, health, and tourism, all showcasing products and services that support sustainable living.
Traditionally, I would reserve my expressions of gratitude for my concluding remarks, but as I look around this stunning setup, I feel compelled to extend my heartfelt congratulations to the Consumer Affairs Unit and the Consumer Protection Commission of the Ministry of Economic Affairs. They have once again executed what appears to be a highly successful World Consumer Rights Day event this year. I would also like to express my appreciation to all of you present here today, the student artisans, the consumers, goods and service providers, and representatives from various government agencies. You deserve commendation for recognizing the importance of sharing your time, your knowledge, resources, and talent with the public. Your support of our ministry's effort to enhance consumer awareness regarding the significance of making informed lifestyle choices is truly invaluable. And I want to just make a disclaimer right here before I go further into the speech, that the words I'm speaking would be the words of the Honorable Michael Akitas, who is your minister. And therefore, if you say, I, Michael Akitas, or my ministry, as of course, I'm not Michael Akitas. So the media would edit appropriately. I will take it as I edit. I want to say that this year's theme, A Just Transition in Sustainable Lifestyles, the United Nations defines the concept of just transition as broadly ensuring that no one is left behind or pushed behind in the transition to low carbon and environmentally sustainable economies and societies. In a world increasingly affected by climate change, pollution, and dwindling natural resources, sustainable living has emerged as a solution to reduce our environmental footprint. People, and many people, believe that adopting sustainable practices means making big sacrifices, and it is ultimately the goal of today's social event to hopefully enlighten consumers as to truth, which is that small, manageable changes can lead to a greener planet. The current Progressive Liberal Party administration continues to demonstrate not only its commitment to this cause, but it's extremely exemplary and visionary in leadership to foresee a need for a just transition policy framework that not only leaves no one behind, but also brings everyone in. The Ministry of Economic Affairs is cognizant also that it's been a tough few years for shoppers and retailers alike, with cost of living pressures on households resulting in consumers reevaluating their budgets, pulling back on retail spending, and changing their retail habits in anticipation of ongoing financial concerns. But while pricing and promotions continue to be an influential factor in consumer spending behavior, there's a growing segment of values-driven shoppers that are increasingly contemplating the social and environmental impact of their purchases. By committing to green goals in 2025, you will be contributing to a movement that will benefit generations to come.
The Clifton Heritage National Park marked the 20th anniversary of its sacred space site with the unveiling of panels for figurines representing some of the most influential women in Caribbean abolitionist history. The unveiling took place at Clifton Heritage National Park on March 12, 2025, as a part of the celebrations for International Women's Month under the theme Accelerate Action.
It is an honor to join you here today at this sacred, beautiful place where history, where art and memory intersect. As we gather here at the sacred space of Clifton Heritage National Park, we are reminded of the strength and the courage of the women who came before us. I would like to begin by expressing my deepest gratitude to Ms. Lynette Reckley, Managing Director at Clifton Heritage National Park, for the kind invitation and the opportunity to address all of you on this special occasion. The work of Clifton Heritage National Park is essential to ensuring that our history remains alive and accessible to future generations. This work allows us all to draw inspiration and wisdom from the stories of those who came before us. We must never forget where we came from, because remembering our past is the only way to appreciate our present and envision where we want to be in the future. Today, we commemorate the 20th anniversary of this sacred space behind me, conceived and brought to life by the extraordinary talent of Bahamian artist Antonius Roberts. These sculptures, as you will see in a while, they are not just works of art. They are symbols of survival, of resistance, and hope. They represent the countless enslaved African women who endured unimaginable hardship, but they held on to their dignity, their culture, and their faith. So thank you so much to Antonius Roberts. If you're here today, thank you as well for providing such a tangible reminder of the legacy that runs through our veins. Under this year's theme, Accelerate Action, which was the theme for International Women's Day, we are called here to honor these women, not only through remembrance, but through purposeful and transformative action. It is not enough to merely reflect their struggles. We must also acknowledge their strength and continue their work by fighting for justice and equality for all women.
I'm Carissa Williamson, and this has been Your Government in Action, a proud presentation of Bahamas Information Services. Join us on Tuesday evenings, where we bring you highlights, coverage, and information as we continue to do what we do best, linking people and government.